Chapter 3: Immunity and Immunologic Oral Lesions. Vocabulary: acantholysis, dissolution of intercellular bridges of the prickle cell layer of the epithelium. Acquired immune response, an immune response to a foreign substance based on the specific memory of a past exposure to that same foreign substance. The second, acquired immune response, is quicker than the initial response. Active immunity, type of immunity based on antibodies developed in response to an antigen. There are two types of active immunity, natural and acquired. Antibody titer, the level of specific antibody in the blood. Antigen, any substance able to induce a specific immune response. Antenuate, to reduce the severity of a disease or a virulence of a pathogenic agent, such as done in the development of certain vaccines. Autoantibody, an antibody that reacts against a normal tissue constituent of one's own body. Autoimmune disease, disease characterized by tissue trauma caused by an immune response against tissues constituent of one's own body. B-cell lymphocyte, a type of lymphocyte that develops in the lymphoid tissue other than the thymus, and that can develop into plasma cells and produce antibodies, the main initiator of humoral immunity. Cell-mediated immunity, a type of immunity in which the major role is played by T lymphocytes. Cytokines, proteins produced by various cell types for the purpose of intracellular communication. Immunological cytokines are developed in the immune response. Dendritic cells, a type of white blood cell that acts as an antigen-presenting cell in the skin and mucosa. Humoral immunity, a type of immunity in which both B-cell lymphocytes and the antibodies they produce as plasma cells play a predominant role. Hyposalivation, decreased salivary flow that result in xerostoma. Immune complex, a combination of an antibody and an antigen producing a complex that can initiate a hypersensitivity reaction. Immunoglobulin, proteins that, when secreted by plasma cells, serve as antibodies designed to respond to specific antigens. Surface immunoglobulins remain attached to the surface of certain B cells and function as receptors. Immunomodulator, a substance that alters the immune response by augmenting or reducing the ability of the immune system to produce antibodies or sensitized cells that recognize and react with the antigens that initiate their production. Langerhans cells, specialized dendritic cells found in the skin and mucosa that is involved in the immune response. Elis cell, mature neutrophils with phagocytized spherical inclusions derived from another neutrophil. It is used as a marker of autoimmune disease. Lymphokines, cytokines produced by B cells or T cell lymphocytes in contact with antigens, mediators in immune response. Macrophage, large tissue-bound mononuclear phagocytes derived from monocytes, circulating in the blood, which can become mobile when stimulated by inflammation and interact with lymphocytes in the immune response. Monokines, cytokines produced by monocytes or macrophages, mediators in immune response. Mucositis, mucosal inflammation due to a disease process. Natural killer cell, type of lymphocyte that is part of the initial innate immune response, which by unknown mechanisms is able to directly destroy cells recognized as foreign. Nikolsky sign, a diagnostic sign whereby the superficial epithelium separates easily from the basal layer on exertion of firm sliding manual pressure with the fingers. Passive immunity, a type of immunity that uses antibodies produced by another person to protect an individual against infectious disease. There are two types of passive immunity, natural and acquired. Plasma cell, a cell derived from B-cell lymphocytes that produce antibodies in response to the presence of antigens. Pruritus, itching. Rheumatoid factor, antibodies that bind to certain antibodies found in serum of patients with rheumatoid arthritis or connective tissue diseases. Current assays test for IgM class rheumatoid factor. T-cell lymphocytes, lymphocytes that mature in the thymus and is mainly responsible for initiating cell-mediated immunity, as well as also modulating humoral immunity. The thymus, an organ consisting of lymphoid tissue located high in the chest, which is large in an infant and gradually shrinks in size in adulthood. Site of T-cell lymphocyte maturation. Lesions. Minor aphthous ulcer. The cause? Unclear immunologic pathogens involving cell-mediated immunity. Trauma is the most common precipitating factor. It's more common in younger than older individuals and also affects women more than it does men. The location is the oral mucosa, not covering bone, and it's found more anterior more than posterior. Clinical features are painful, discrete, round and oval, yellowish white ulcers, halos of erythema up to 1 cm in diameter, and spontaneous healing within 7 to 10 days. Treatment is topical corticosteroids. Major aphthous ulcer, or also known as Sutton's disease. The cause is unclear immunologic pathogenesis involving cell-mediated immunity. The location is the oral mucosa not covering bone, often occurring in the posterior oral cavity. The clinical features are characterized by painful, greater than 1 cm in diameter, and deeper than minor aphthous ulcers, may last several weeks, often healing with scarring. The treatment is topical or systemic corticosteroids and a biopsy to rule out ulcerations from other causes. Herpetiform aphthous ulcers. Cause? Unclear immunologic pathogenesis involving cell-mediated immunity. The location? Anywhere in the oral cavity. Clinical features involve the painful, small 1 to 2 mm ulcers, often occurring in groups, resolving spontaneously. The treatment is topical corticosteroids or topical tetracycline. Urticaria, also known as hives. Cause? Type 1 hypersensitivity. The release of IgG, IgM, often in response to ingested allergens. Infection, trauma, and emotional stress are also associated with hives. Location: localized vascular permeability in superficial connective tissue. The location is the skin. Clinical features involve multiple areas of well-demarcated swelling, accompanied by itching, self-limiting episodes. The treatment is identification and avoidance of the causative agent and antihistamic drugs. Angioedema. Cause? Type 1 hypersensitivity, trauma, release of IgG or IgM, permeability of deeper blood vessels. Location is the skin or mucosa. Clinical features involve diffuse swelling of the tissue, usually has no itching, and are in self-limiting episodes. Treatment is identification of the causative agent and antihistamic drugs. Contact mucositis. Cause? Direct contact with allergen with mucosa. Location? Mucosa in contact with allergen. Clinical features involve smooth, shiny, firm mucosa with erythema and edema. May form vesicles, often an itching or burning sensation is present. Treatment is identification of the causative agent, topical and systemic corticosteroids. Contact dermatitis. Cause? Direct contact with allergen with skin. Location? Skin in contact with the allergen. Clinical features involve erythema, swelling, vesicles to encrusted scaly white appearance. Treatment: identification of the causative agent, topical and systemic corticosteroids. Fixed drug eruptions. Cause: type 3 hypersensitivity. Location: same site each episode, usually skin, occasionally oral mucosa. Clinical features: lesions appear when drug is induced and subside when the drug is discontinued with increased intensity. Single to multiple raised reddish patches or clusters or macules. Pain and itching may be present. Treatment: identification and discontinuation of causative drug. Erythema multiforme, also known as Stevens-Johnson syndrome. Its cause is unclear, but there is evidence for hypersensitivity reaction that in some cases may be associated with infectious agents. Stevens-Johnson syndrome is related to drugs. It's more frequent in young adults and affects more men than it does women. The location is skin and mucous membranes. When it's on the skin, it's characterized by a target-shaped lesion. Also, macules, plaques, and bullous are present, or can be present. On the mucosa, it becomes erythemic, ulcers, crusted bleeding lips, and explosive onset. The treatment is identification of the causative agents, if possible, topical systemic corticosteroids. Lichen planus. Cause: unknown. Broad age range, increasing prevalence in middle age, affecting more women than it does men. Skin and oral mucosa lesions. When found in the oral mucosa, the areas that may be affected include the buccal mucosa, tongue, labial mucosa, floor of mouth, and gingiva. Clinical features include oral lesions, Wickham striae, erosive and plaque-like lesions may occur. In gingival lesions, desquamative gingivitis, looking like spider webs. Treatment? None, if asymptomatic. Topical corticosteroids if symptomatic. Follow-up evaluation. Reactive arthritis. Cause? Abnormal immunologic response to infectious agents and has a genetic influence of the presence of HLA-B27, affecting more men than it does women with a ratio of 10:1 to 15:1. The location is conjunctiva, urethra, oral mucosa, skin, knee and ankle joints. Clinical features include syndrome triad, arthritis, urethritis, conjunctivitis. Skin lesions, oral lesions, aphthous-like ulcers, lesions resembling geographic tongue. Treatment: ASA and non-steroidal anti-inflammatory drugs. Langerhans cell histiocytosis, also known as Langerhans cell disease. Cause is unclear, suggestive reactive process with immunologic disease and neoplastic process. Clinical features are urethemic lesions. Acute disseminated form, affecting children under the age of 3 years old. The location, disseminated disease. Treatment, chemotherapy with a poor prognosis. Diagnostic process, chemotherapy. Chronic disseminated multifocal form, affects children under 5 years of age. And the clinical features include the classic triad, skull radiolucencies, exophthalmos, diabetes insipidus. In the oral lesions, sore mouth with or without ulcerations, halitosis, gingivitis, unpleasant taste, loose sore teeth, early exfoliation of teeth. Radiographically, radiolucencies or punched out areas of the skull, maxilla, mandible radiolucencies including alveolar bone. Diagnostic processes include clinical and microscopic. Solitary localized form. The cause? Unclear. Suggestive reactive process, immunologic disease and neoplastic process. Affecting older children and young adults, affects more males than it does females in a 2:1 ratio. The location is the bone. The skull and mandible are commonly involved. Radiographically, radiolucency may resemble periodontal disease or may be well circumscribed radiolucency, may be multifocal. Treatment is conservative surgical excursion or low-dose radiation treatment. Sjögren's syndrome. Cause: autoimmune disease, decreased lacrimal flow, decreased salivary flow. Location: eyes and oral cavity. Primary syndrome includes dry eyes and dry mouth. Secondary syndromes include dry eyes, dry mouth, along with other autoimmune diseases. The treatment for xerostomia, saliva substitutes, and saliva stimulants such as pilocarpine. Diagnosis process: clinical, radiographic, microscopic, and laboratory. Systemic lupus erythematosus. Cause: autoimmune disease, affecting more women than it does men by 8:1 ratio, and African Americans more than it does whites at a 3:1 ratio. Location: multiple sites. Skin, mucous membranes, joints, eyes, central nervous system, kidneys, hearts, and other organs. Clinical features include oral lesions, erythematic plaque or erosions, white striations radiating from center to lesion. Treatment: anti-inflammatory and immunosuppressant agents. Diagnosis process: laboratory, microscopic, and clinical. Pemphigus vulgaris, an autoimmune disease affecting children and adults, more common in 4th and 5th decade, more common in Jews. Location: mucous membranes and skin. Clinical features: progressive involvement of mucous membranes and skin, oral lesions, painful erythema, vesicles, bulla, erosions, and positive Nikolsky sign. Treatment: corticosteroids and other immunosuppressant agents. Mucous membrane pemphigoid. Cause: autoimmune disease. Found in adults, commonly found in the mucous membrane in the gingiva, but may also affect the eyes. Clinical features involve oral lesions, desquamative gingivitis, bulla, erosions, ulcers. Lesions heal with scarring. Treatment: topical or systemic corticosteroids. Diagnostic process: microscopic. Bullous pemphigoid, autoimmune disease. 80% affected are over the age of 60 years old, and its location is the mucous membrane and the skin. Clinical features involve oral lesions such as cicatricial, pemphigoid, but less common. Treatment involves systemic corticosteroids and other anti-inflammatory agents. The diagnostic process is microscopic. Beckett syndrome, autoimmune disease. The average onset of this disease is 30 years of age. It's located in the mucous membranes, oral, genital, or ocular. Clinical features include oral lesions and aphthous-like ulcers. Treatment include corticosteroids and other immunosuppressant agents. The diagnostic process is clinical.